Today we are going to talk about rubella infection, which is also called German measles. It is very important exam topic. The incubation period is 14 to 21 days and infectivity is 7 days before and 7 to 10 days after the onset of the rash. All right, the maximum transmission is in the first trimester. If the patient is coming in the first trimester with this infection, we are going to counsel the patient that the baby is going to have abnormalities, which is almost 90% damage. So we advise termination of pregnancy. So in the second trimester, 11 to 16 weeks, the transmission is 55% and the damage is 20%. More than 16 weeks, the transmission is 45% and there is very minimum risk of deafness. And after 20 weeks, there is no risk. So in congenital rubella syndrome, there is 80% sensory neural hearing loss, 60% heart defects, 60% CNS defects, 30% cataract and glaucoma, and 40% purpura, and 20% risk of miscarriage. When we are going to run the serology test, if the IgG is positive, we are going to reassure the patient that she is safe. But if it is negative, we are going to do IgM test. If it is positive, we will discuss the treatment plan with the patient and we will do the counseling. And also we will see where is the patient in her pregnancy journey. If she is in the first trimester and less than 16 weeks, we will advise termination of the pregnancy, and if the patient says that she wants to continue the pregnancy, then we will do fetal echo and growth scans 2 weekly. This is MCQ question. If the patient does not want to have termination, this is what we are going to do. All right. So if the IgM comes negative, we are going to retest the patient after 4 weeks. This is MCQ question. Now for IgG serology, if the enzyme immune assay is less than 10 international units per ml, that means patient can have infection. There is a risk to patient. And about avidity, if it is high, that means it is a past infection, and if it is low, that means it is primary infection or recent infection. Now the treatment, this is MCQ. All right, if a patient is coming before 16 weeks with rubella infection, IgM positive, this is what we are going to do: termination of the pregnancy or fetal echo and 2 weekly growth scans. All right, at 12 weeks, same treatment, but after 16 weeks, the risk is negligible. All right, the patient can continue the pregnancy, but definitely we will monitor the baby on anomaly scan. We are going to do fetal echo and we are going to monitor the growth of the baby. So about congenital rubella syndrome, the infant sheds virus in urine and nasopharyngeal secretions for up to 1 year, and it requires infection control precautions. All right. So if you have any questions, you can ask in the comment section. Thank you.